So hi guys, today we are here to discuss this Rajasthan MO paper 2024, and I'll be discussing with you the questions which were asked in the subject of the surgery. Okay, so I have 5 questions. Frankly, out of these 5, one is not even related to the surgery, but yeah, let's kind of go through them. So this particular question was asked here, which I personally feel is not that much dependent on the surgery. Yeah, let's kind of go through it. So 75-year-old patient clutches the chest and falls down. That's fine. The physician arrives and on the scene, what is the first thing to be done? So clearly, what is this? This particular patient is basically suffering from heart failure. Okay, heart failure. Because of this, the patient basically had like pain in the chest. Okay, and then the patient fell down. The patient is basically in the state of the cardiogenic shock. Okay, now in this particular scenario, what you need to follow is something which is called as a ACLS guidelines. That is Advanced Cardiac Life Support Guidelines. Now, in this, the first thing which you basically have to do is call for help. You have to call for help because, like, just by yourself, you cannot do much. So you have to call people for help, and then you will kind of go ahead with an ABC, that is airway, breathing, and circulation. That is what you're going to kind of check. Oh, sorry, no, here what you have to kind of follow is CAB. Okay, so first thing you have to kind of look for the circulation, then you have to look for the breathing, then you have to kind of look for the airway. Okay, what the hell I'm doing? It is CAB, that is circulation, airway, and the breathing. Okay, so as I told you, this is not related to the surgery. It is more of a medicine, but frankly, it is every doctor should kind of know this particular stuff. That is what is an ACLS guidelines. Okay, I hope you have understood. The first thing which you will do is call for help. Now, why did I not tell the team that, you know what, that's not my domain and just give it to the medicine people? I don't know whether this would have been covered in the medicine as well, but I did not do that because I wanted to take a chance to kind of discuss with you also the ATLS guidelines. What is this ATLS guidelines? This is Advanced Trauma Life Support Guidelines, which is basically under my domain, that is the surgical domain, right? So whenever there is a patient with a body trauma, what we basically have is we have a patient, and then what is the sequence of the events which we follow? We follow something which is called as a small c, A, B, C, D. So what does this small c basically stands for? This was the doubt which was asked to me by one of the students on a group. So what you need to understand, this C basically stands for control of external hemorrhage. Okay, so let's assume that after a trauma, if at all there is a patient who's coming to you with a massive bleeding from some vessel or something like that, you have to kind of control that bleeding. Then you basically have to look for airway, breathing, circulation, and the disability. On the other hand, in the ACLS guidelines, the first thing which you have to look for is the circulation, but before that you have to call for help. Okay, so that is what you need to understand over here. Okay, understood? Right. Now, which is the non-absorbable suture. Now, this is basically my domain. Now, the options which they had given you is a bit kind of varied. But the answer over here is this Vitalium suture. Okay, so this, what is this polyglycolic and the polymer suture, whatever. So this is what is your Vicryl. They were basically trying to talk to you about the Vicryl, then collagen. Obviously, we do not use that much. And the catgut. Catgut is something which is a naturally occurring absorbable suture. Naturally occurring absorbable suture. Absorbable suture. So let's kind of take an opportunity to discuss a bit about these particular sutures, the absorbable and the non-absorbable. Let's kind of focus on the absorbable sutures. So the absorbable sutures, they basically can be either naturally occurring or they can be synthetic. So they can be natural or they can be synthetic. Okay, I hope you're able to appreciate the absorbable sutures. They can be either natural or they can be synthetic. What basically comes under the naturally occurring absorbable sutures? So here what we have is a catgut. And what about in the synthetic? What we have is Vicryl. Then we have what you call as a monocryl. Then we have PTS. So let's kind of stick on to these three. Okay, so what about the catgut? Catgut is basically derived from the submucosa. This is important. From where it is derived? It is basically derived from the submucosa of the intestine of the sheep. Okay, submucosa of the intestine of which animal? Sheep. Now the problem with this particular catgut is that it is having absorption time which is very less, around 3 to 5 days, 3 to 7 days. And this catgut, because it is a naturally occurring absorbable suture, it is absorbed by the process of enzymatic degeneration. Okay, and in order to increase this particular absorption time, what we did was we kind of coated it with the chromic acid. Okay, so we kind of converted it to a chromic catgut. Catgut. So what is this chromic catgut? This is basically a suture which is this is a simple plain on catgut which has been coated by the chromic acid so that the absorption time basically increases. But the problem of this enzymatic degeneration still existed. Now what is the problem with this particular enzymatic degeneration? Wherever there is an involvement of an enzymes, there is an exothermic reaction, and because of this what is going to happen? There is going to be a lot of tissue reaction. Okay, so there's going to be a lot of tissue reaction which is going to take place in the absorption of this naturally occurring absorbable sutures. Okay, on the other hand, the synthetic absorbable sutures, and the synthetic absorbable suture, what you need to understand, we have a vicryl, we have monocryl. Now for this, the absorption time is 60 to 90 days. What is the absorption time? It is 60 to 90 days. Then what we have is PDS. PDS is also referred to as your delayed absorbable suture. What is it called as? It is called as a delayed absorbable suture. This is called as a delayed absorbable suture. Over here, the absorption time is 180 days. Okay, so what is the absorption time of this? It is 180 days. Please try to understand this particular point, guys. Okay, so synthetic absorbable suture, like this monocryl, vicryl, and the PDS, and PDS is basically delayed absorbable, which is having the absorption time of 180 days. Now, quickly, can you tell me what is the process in which these synthetic absorbable sutures are basically absorbed? So the natural ones, we saw that they were absorbed by the enzymatic degeneration. The synthetic ones, they are basically absorbed by the process of phagocytosis or hydrolysis. Okay, so they are absorbed by the process of phagocytosis or the hydrolysis. I hope you have understood this particular point. Very, 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 very important. Okay, I hope you have understood this. Okay, now let's talk about this. For the diagnosis of the salivary gland tumors, which of the following is true? So whenever you have any particular kind of swelling of the salivary gland, the first investigation which you have to do is a FNAC. FNAC should be done in order to kind of arrive at a diagnosis of a salivary gland. That is the first investigation which you basically do, which is going to tell you whether you're dealing with a pleomorphic adenoma, Wadden's tumor, whatever. So FNAC is the thing which you basically perform whenever you want to diagnose the patients with any particular salivary gland swelling. Okay, I hope you have understood this particular point. That's fine. Now, which of the following disorders is characteristic of the Hürthle cells? Okay, this is an important question. This was a bit of a depth question, I would say. Okay, so what you need to understand is that the answer over here is a Hashimoto's thyroiditis. What is a Hashimoto's thyroiditis? The another name of the Hashimoto's thyroiditis, it is also referred to as a stroma lymphomatosum. So essentially what is happening in this particular Hashimoto's thyroiditis is that the thyroid gland is basically attacked by the T cells as well as the B cells. So in the B cells, they produce the antibody, and these particular antibody, they go and destroy that particular thyroid gland altogether. And that is why this Hashimoto's thyroiditis, what is it? It is the most common cause of hypothyroidism. Okay, so the most common cause of hypothyroidism is your Hashimoto's thyroiditis. Now, which antibodies are responsible for this? So anti-topoisomerase antibodies, anti-TPO antibodies. So these are the ones which are more specific. Anti-thyroglobulin can also be there, but if at all both are given in the options, obviously you have to go ahead with anti-topoisomerase, thyroglobulin. Okay, so that is what you need to understand. Now, the way we can basically diagnose these particular Hashimoto's thyroiditis is with the help of an FNAC. So when you basically perform an FNAC in the patients with the Hashimoto's thyroiditis, what are you going to find? You are going to find Ashkenazi cells or the Hürthle cells, and you're going to find lymphocytes. Okay, so lymphocytes and Ashkenazi cell or the Hürthle cells, these are the things which you basically find in the patients with the Hashimoto's thyroiditis. Okay, so this was a good question. I hope you have answered it. Hashimoto's thyroiditis is the Hürthle cells. Now, if you would have read things in a bit more detail, what you would recall is that there is something which is called as a Hürthle cell variant of follicular carcinoma of thyroid. So do not get confused. Probably the same person basically gave both of them. So there is a variant of a follicular cell carcinoma, which is a Hürthle cell variant. But Hürthle cells are basically seen on the FNAC in the patients with Hashimoto's thyroiditis. Now, before we move ahead, can you please tell me what is a long-term complication? Or if at all there is a patient who is having Hashimoto's thyroiditis, this particular patient is at a risk of developing which malignancy? Can you please help me with this? So answer is thyroid lymphoma. Okay, so this is again an important question. Why do you want to remember this? Because as you can see, it is a lymphomatosum. So lymphocytes are basically infiltrating into the thyroid gland, and that is why over a period of time, eventually the patients may land up with the thyroid lymphoma. That is what you need to understand over here. Now, the tongue ulcers are everted edges. So this is, they were just trying to ask you, the everted edges is basically a feature of what? So it is a malignant ulcer. So everted edges are basically seen in the malignant ulcer. In the tubercular ulcers, what kind of edges do we see? We see undermined edges. Okay, so this is very, very important for you guys. They keep on asking you, so what about the sloping edges? Sloping edges are basically seen in the healing ulcer or the venous ulcer. Okay, so the sloping edges are basically a feature of your healing ulcer or the venous ulcer. Punched out. Okay, so punched out edges are basically seen in what? So they are basically a feature of your arterial ulcer, arterial or syphilitic ulcer. Then what do we have? We have undermined. We just talked about undermined edges. They are basically a feature of what? Tuberculosis. Okay, so tuberculosis have an undermined edges. Then what do we have? We have what you call as a everted edges, and then we have a rolled out edges. So the two edges which we have is everted edges, and then we have a rolled out edges. So if at all they give everted edge with indurated base, okay, everted edge with the indurated base, this is no doubt that this particular thing is what? This is basically your squamous cell carcinoma, and rolled out edges are basically seen in your basal cell carcinoma. Okay, so this is, they keep on asking you this in one form or the other. This is a very, very important question for you as far as your MDS entrance is kind of concerned. I hope you've understood. The answer over here is going to be malignant. They did not give you specifically the squamous cell carcinoma, but yes, the answer would be malignant. I hope you gained something out of this, guys. Yeah, thank you so much. Have a great time. Happy studying. See you next time. Bye bye. Take care.